The summons issued earlier in the week against officials of the union were for them to appear before the Employment and Labour Relations Court to show cause why they should not be jailed for disobeying court orders. And they have obliged. The union says the officials will be present before court and all doctors will be in the court to give their support. The strike, which began on Monday this week, entered its sixth day today as patients in public hospitals go without the critical caregivers attending to them.
Solidarity forever.
The nurses who have been on strike with the doctors demanding the implementation of their collective bargaining agreement and recognition of their union across all counties say they will not resume work until their demands are met.
We can't call off a strike now. We have not found a permanent solution. Then again, after 1 month, we are telling our members we want to go back to strike.
They insist that they will negotiate any time unless the government backs out or they are arrested, as has been threatened before.
We are not scared of rumor going around that they want to arrest us. Let them arrest us. We don't care. When you go to war, you expect to die or to survive. Anybody who goes to war must be ready. Blood will be shed.
There have, however, been headway on the recognition agreement. The nurses' union says that the copies are being printed and will be delivered to the counties to be signed by the relevant authorized officials. But the nurses have now threatened their colleagues who have chosen not to down their tools in solidarity with the union. They say when the strike is over, they will not be willing to work with them or allow them in the union.
The union will not work with home cards. The union will not associate with home cards. And we will not agree for you to be employed in public service. As long as a union, we are here. The only option you have is to join the union between now and Tuesday and go on strike. But if you purport that you are taking over our positions, you are a home card and we shall deal with you thoroughly. Unless the county government go and build hospitals for you, for home cards, you go and work there.
The government spokesman Eric Kiraithe, however, says that all public health workers who have chosen not to go on strike will be safe.
It is criminal to attempt to stop anybody from doing what they have chosen to do when that person is not breaking any law.
He has announced that several other healthcare professionals who had not been included in the negotiations will now be in the talks with the government to also have a collective bargaining agreement of their own. They include clinical officers, nutritionists, physiotherapists and social workers, among others. The association, however, says its members are not on strike and want the doctors and nurses to get back to work.
The greatest burden you'll carry to your grave is to go to your grave in the knowledge that there is a day you could have saved a life and you failed to do so because you wanted a little bit more coins on your payslip.
Meanwhile, in Tanariva, the nurses have allowed some of their members to go back to work and assist in controlling an outbreak of cholera in the area. Andrew Ochieng, NTV.